So what about pregnancy? Any experience with the hypoxemic respiratory failure in pregnancy and patient being on ECMO because it's rare but very high stakes? And
Yeah.
how does
The-
your threshold also changes for the ECMO in such cases? Is there any change?
yeah.
It remains
It's a
the
true. A nice question, but it's a very special cohort. A few of the things I'd like to share here about pregnancy and ECMO. Um, our first awake ECMO patient was a pregnant female, an postpartum female who had ARDS from H1N1, and we extubated her to favor mother-baby bonding so that she could feed her baby.
baby.
Okay, so I'm just again tying up with your previous question. The second thing I would like to comment is outcomes are very good for VV and VA ECMO in pregnancy. And that's mainly because this cohort of patients are relatively young. They always have regular antenatal checkups, which means they are monitored much more closely and their derangements are picked up much more early. And when they get sick, given this kind of, care that we offer them antenatally, we are able to offer ECMO at an appropriate time, and about 70 to 80% of these patients eventually survive. In fact, it's not just maternal survival, fetal survival is as good as 70 to 75%. So this cohort of patients, the pregnant cohort of patients, pregnancy is not a contraindication. You will have challenges. I think the fact that they are procoagulant and the fact that ECMO needs anticoagulation has been hyped very high in literature to the point that you start thinking whether you should offer ECMO to these patients just for fear of bleeding. But if you look at their incidence of bleeding is as good as a normal ECMO patient. So this group of patients actually do well, and clearly, we've had pregnant patients who have been who have gone on ECMO. And on that note, the ELSO guidelines on pregnancy and ECMO should be up next week. So I happen to be a co-author in it, and clearly, it's one of those where we have highlighted all these aspects.
By the time this podcast get released, they must have been.
Yeah, definitely they should be able to get it free online. Yeah.
So of course, as we talk about the pregnancy, proning is also not that easy. So does the threshold of the ECMO changes in them, as we spoke about? You prone
Yeah.
and then do it. In this case, how do we do it? Shall we prone them, or if yes, then
Yeah. So if you ask centers that are adept at proning, say, talk to the French guys, they would still try to prone pregnant patients as well. Okay. So of course, they've been doing this for a long time, so they know how to do it. And a few of them would partially prone them with disease lung going dependent. So that's one way of looking at the proning variants. But your was essentially right. So most of these patients, it'll be difficult to prone position. So your threshold for going on ECMO is when conventional ventilation fails. So you may not be able to give them even a trial of prone positioning.